For decades, bone cancer in an arm or leg often meant amputation. Today, most patients have another option. Limb salvage surgery removes a bone or soft tissue tumor along with a margin of healthy tissue, then rebuilds the limb. It's used for bone cancers like Osteosarcoma and Ewing sarcoma, soft tissue sarcomas, and some tumors that have spread to bone. A specialist team plans the surgery using MRI, CT, and biopsy to map the tumor and check whether nerves and vessels can be preserved. During surgery, the tumor is removed with a cuff of healthy tissue around it. Clear margins reduce the chance of the cancer returning locally. Surgeons then rebuild the gap using a metal implant, donor bone, the patient's own bone, or a combination of these approaches. Muscle and skin are often rearranged over the reconstruction to protect it and help healing. Drains are placed before the wound is closed. The hospital stay is usually 1 to 2 weeks. Rehabilitation begins almost immediately, guided by a physiotherapist. Recovery progresses in stages: healing at 6 weeks, stronger movement by 3 months, and functional recovery over 6 to 12 months. For aggressive sarcomas, chemotherapy is usually given before and after surgery. Radiation is added for certain tumor types. Risks include infection, blood clots, wound problems, implant loosening, and rarely, local recurrence. Specialist centers help reduce these. In children, growing bones need special approaches like expandable implants, living bone grafts, or rotationplasty around the knee. Most patients regain walking and daily activities. Low-impact exercise like swimming, cycling, and walking is usually encouraged. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.